Hi, this is John Goodman once again, talking to you from my living room and self-isolating. You know, I had the opportunity just the other day to talk with Wayne Orchard from MyTelemedicine, which is one of the up-and-coming telemedicine companies in the country. And we had an opportunity to go over what they're able to do for patients and why this is so much better for patients than going to the emergency room or the doctor's office when they think they have a problem.
Hi, this is John Goodman again, self-isolating in my condo, and I assume that most of you are doing the same. You know, when Donald Trump was sworn into office, there was a law of Congress that said that Medicare doctors could not talk to their patients or consult with them by means of phone or email or Skype or Zoom or any other telemedical device. And that was a restriction that Congress put on the whole Medicare program. Also, at that time, it was illegal for employers to put money into, say, a health savings account and then let employees choose a direct primary care doctor, what we used to call a concierge doctor, that's available to patients at night and on weekends 24/7. The president and Seema Verma and the head of the Health and Human Services, they have made some remarkable changes in federal policy just on the president's executive orders. And then when the coronavirus hit, we got some cooperation for the first time in a long time out of Congress. So today it's a new ball game. And I read just this morning that in December, Zoom had 10 million daily customers, and today it has 200 million daily customers, and is wondering how it's going to handle all of that. Well, with me today is Wayne Orchard, and he is with a company called MyTelemedicine. And we invited him to join us because we want to know what a telemedical company does and how it works. So Wayne, you might give us just a few words on what you do.
Telemedicine is, and what a telemedicine vendor does, is we have a network of doctors, all board certified throughout the U.S., and so all 50 states. We have doctors that can treat people over the phone or by video, diagnose, treat, and even write a prescription electronically to a local pharmacy for that person to pick up. A cough, cold, flu, rash, UTIs, pink eyes, something that you would run off to your primary care physician for, go in, and what would be a 5-minute visit turns into a 2-hour ordeal. AMA had come out and said 78% of all doctor visits could be done via phone with the doctor.
Wow. Wayne, where do you find the doctors who do this?
Yeah, so we contract with the doctors. So they're not our employees, right? They let us know when they're available, and our system then will allow them to come in, pick up the consult, and have all the information, and they can do it by their phone. We can redirect a lot of those urgent care and emergency room, visits to a telemedicine visit to keep insurance premiums down.
So mainly patients find you through their employer. The employer does a contract with you. And does a patient pay anything when they contact the doctor?
Over 95% of all of our population pays absolutely nothing when they talk to a doctor. It's all taken care of through a subscription base. So just like an employer pays for insurance, and then you have a copay plan, and sometimes you have where there was a zero copay. Well, same thing on ours is that it's very reasonable price, very inexpensive really for an employer to get coverage for all their employees. And when the employee calls, there's zero cost to them.
Do they typically interact the way you and I are interacting over Zoom? Would that be normal?
So not through Zoom. So we have a HIPAA secured environment within our portal. So our members have what we call a member portal dashboard that they log into. That can be through their laptop or desktop or via the app. And the doctor also does the same, and they connect inside of our system.
You mentioned the laws. I didn't mention that you are a Texas company, is that right?
Yes, we are.
And the Texas Medical Association a few years ago tried to run you guys out of business, along with Teladoc and just about any other firm that does what you do. Fortunately, you prevailed, did you not?
Well, we did. As an industry, we did. And a lot of that was because of Teladoc, because we make sure that we're following a 50-state guideline. Like the state of Idaho, you can only do video. You cannot do telephone for telemedicine. So our system makes sure that the only way that a doctor and a patient can connect is through video there. Now, right now, during the COVID, they said, forget it. You can use telephone if you want, but once this is over, it's going to go probably right back to that.
Well, that's true of so many of these regulations that we might talk about in a minute. But until very recently, a company like yours had to connect a patient with a doctor who is licensed in the state where the patient was.
Yes.
Am I correct on that? And the Trump people have said, look, that's an unreasonable restriction. And as far as I know, they have taken away all federal impediments to doctors practicing across state lines in another state in which they're not licensed. How far have we gone with that?
So the federal guidelines, they say, hey, do what you need to do. Now each state has to approve that and say, yes, like if in Texas, the state of Texas has to say, if you're licensed in any other state, we will allow you to perform telemedicine in this state.
Has Texas done that?
Yes. So we have about,
good for them.
I want to say there's probably about 12 to 16 states right now that have allowed cross-border licensing.
Before we had the coronavirus, if I live in Dallas, but I'm up in Chicago and I call your company, you have to have an Illinois doctor, right?
Right. Yeah, exactly. We have to have someone that is licensed in that state in order to diagnose, treat, and prescribe for that. President Trump, VP Pence, said, hey, let's use telemedicine. I mean, every news conference that you saw was telemedicine. For the next 2 weeks, our calls spiked, tripled.
Really?
From this.
Are you getting calls from employers, or are you getting calls from individuals on their own?
These were individuals calling and wanting medical advice from one of our doctors.
If I'm one of your members, I'm a patient, I call in, does the doctor have my medical records, or does the doctor have any medical records about me?
Just like when you go into primary care, urgent care, they hand you the chart, say, here, please fill this information out. We need to know what medications you're on. We need to know what medication allergies you have, any chronic conditions. We also have a physician portal. So our physicians go into that portal. We'll see the medical records. We'll see all the symptoms that the person has and the reason that they're calling before they even connect through our system to that member.
Let's say I had a problem back in December, maybe I had a rash or something. The doctor prescribes antibiotic. I call in again this March. Of course, I'm talking to a new doctor. Is this new doctor, does he call up the record? Does he know what happened to me back in December?
So when the physician pulls up that member's record, it has all the consults, right there. And they even, before they connect to the member, they have to sign off that they reviewed the medical records and all previous consults.
Let's suppose I'm just an individual. I call up your company. What can I expect to pay when I get service from you?
Right now during COVID is a pay per use. So they can actually go in and select and just pay that one-time fee. Or
Tell us what that would typically be, say for a 30-minute consultation. How much would that be?
$49.
That's
So,
not too bad.
No,
Well, that's
no.
probably less than half of what it would cost if I went to the doctor's office. Is that right? Maybe a
Yeah.
third? Wayne, we need to wrap up here, but I want to do it by noting something you said a little bit earlier. And that was that a lot of the deregulation that's going on that permits the expansion of the kind of service that you're providing to people is temporary. That is, it's by way of an executive order that could easily be changed by another president, or it's by an act of Congress that said it's only going to be for the time period that we have this virus problem. And when the virus goes away, the regulations come back. So everybody who is listening to us right now needs to know that if you like this service, if you want to be able to talk to your doctor by phone, email, Skype, in that way, get treated in your own home, we need to put some pressure on Congress to make these deregulatory reforms permanent. Thank you all for being with us today.
Thanks so much for spending time with me this morning. I think you know we're a nonprofit organization. We depend on voluntary contributions from people like yourself, and that's the only way we can sustain the work we're doing. If you like what we're doing, you want us to continue doing it, then we do need your help. And on the page below this video, there's an opportunity for you to give to us. And if you have a few extra shekels in your pocket, now's the time we could use the help.